Hey guys, this is Alyssa, and this is my response to Pharmacology Discussion 4. I'm going to keep this short and sweet because my mouth is swollen and still hurts from wisdom tooth surgery. You can see it bruising up too. Alright, what is significant about what happens near the 6-minute 13-second mark of the film and beyond? I noticed at this point that they stopped ventilating the patient to draw up RSI meds and to get intubation supplies ready. While someone's getting supplies ready and drawing up medications, someone could still be ventilating the patient, especially with their oxygen saturation being that low. They keep trying to establish an advanced airway on the patient when her SpO2 is dangerously low in the 40s. We should not be trying to intubate a patient that has SpO2 in the 40s. We should oxygenate them enough up to as close to 100 as we can get. Because while we're attempting an intubation, the patient's not breathing and the body's not receiving oxygen. I also noticed there was no communication between the doctors about her oxygen status. They didn't even seem to realize how bad her oxygen status was and how long she was in such a low SpO2 level. They were just focusing on trying to intubate her. They were just looking through tunnel vision, it seemed like. They weren't paying attention to her SpO2 levels, the cyanosis on her face. That's why it's important that you, point to someone and say, hey, I want you to watch the SpO2 levels and let me know when it gets below a certain number. They also noticed that the nurses tried to help by setting up a cricothyrotomy kit and getting her a bed in the ICU, but the doctors seemed to have, completely ignored them. What could be causing the poor oxygenation and zero end-tidal CO2? So the poor oxygenation can be caused by her upper airway being completely obstructed. It means even the ventilations they're giving her are not getting through the lungs. Could also make sense as to why they weren't able to get a LMA down her mouth and into her throat. Also can explain why they were having so much difficulty passing an endotracheal tube. Is that something caused her upper airway to just swell or become completely obstructed. As for the zero end-tidal CO2, could be something as simple as the sensor may not have been connected correctly. It could have been equipment malfunction, or there wasn't enough CO2 for the sensor to detect since she was without oxygen and breathing for so long. If she's not able to exhale, there's not going to be any end-tidal CO2. And if she's not breathing and having that gas exchange, then her body probably isn't producing enough CO2 to be able for the sensor to pick up on. List 5 failures that occurred during this RSI. There were several failures. I did just pick 5. But there were some things they did right. I will say, they did have multiple equipment out in the beginning, different LMA sizes, just in case the first one didn't work. The original doctor tried holding the mask with 2 hands and having the nurse ventilate the bag to see if a better seal would give her adequate ventilations. They gave additional induction medication when they realized that her jaw was still tense. So they did a few things right, but they did a lot of things wrong. So at least 5 of the failures that I saw. 1, she was not pre-oxygenated. So she was awake talking to them, and then they immediately pushed the propofol or whatever induction medication they had and put her to sleep and stopped her breathing. I just had my wisdom tooth surgery, and before they pushed my meds to put me to sleep, they pre-oxygenated me with a nasal cannula with oxygen. Yes, she was a healthy individual. Yes, I'm a healthy individual that had a good SpO2 reading, but you want to pre-oxygenate everyone, no matter how healthy they are, how good their SpO2 is, to 100% SpO2, and for 2 to 3 minutes after that. You want to make sure the body has extra oxygen reserves before attempting to take over their airway. Because while attempting to take over their airway, they're not breathing. And just like what happened in this video, if there's complications, you're going to have less time to try and figure out an advanced airway. Like they were talking about the oxygen dissociation curve, where like once that SpO2 starts dropping, it just gets faster and faster, the levels that it falls. So one thing was she was not pre-oxygenated. The second thing, they didn't lubricate the LMA. So that could have been part of the reason why they weren't able to get it into her throat. Number 3, they were more focused on intubation rather than oxygenating. This was very dangerous and it's probably what led to her dying, brain death. They didn't start oxygenating the patient with the BVM until her SpO2 was around 74%. That's way too low. She should have been oxygenated way before this, at the latest when her SpO2 was in the high 80s. Number 4, there was a communication breakdown for sure. There was little to no communication between the staff about her deteriorating oxygen levels. The doctors weren't listening to the nurses' suggestions. No one was talking about her SpO2 going down and, hey, we need to pre-oxygenate her. We need to get her oxygen levels back up. Number 5, after several attempts at intubating and ventilating with no success, they did not move to a more advanced airway like a cricothyrotomy. They should have moved on to cricothyrotomy since they couldn't intubate or oxygenate/ventilate.